It's your girl Nikita.
It's your girl Tash.
And you're listening to Two Chickpeas in a Podcast. Have you missed us? Because we missed you. We took an abrupt pause from the podcast to focus on our mental health. And ironically, the topic of mental health is what's brought us back to the podcast here today. We're joined by lovely guests, Dr Nighat Arif and Harmeet Kaur. Thank you so much for joining us here today.
So we're going to talk about NHS Talking Therapies, and the reason why we came back so abruptly as well is because it's a topic that's really passionate to us. We two chickpeas have our own mental health struggles and really have been through it, I think, in the past year, hence why we took the break. I myself have used the NHS Talking Service therapies as well, and who better than Dr Nighat to talk to us and Harmeet to tell us her own experiences. So should we jump right into it?
So a survey was conducted by the NHS asking people how confident they feel about recognizing the symptoms of various conditions such as OCD, panic disorder, general anxiety, lots of conditions like this. And in the South Asian community, only 2 in 5 people responded. So 38% responded saying that they felt confident enough to recognize symptoms of these conditions. But that means that 2/3 of the population or people who took the survey aren't confident in talking about it. And they don't feel confident in recognizing the signs. So we're here to talk about that a bit more today. And yes, we are here with lovely Dr Nighat Arif, who we briefly introduced before. She's a GP, she's a women's health specialist and a passionate advocate for making health information accessible to everyone. You would have recognized her from TV, including This Morning, and she regularly shares practical, straight-talking advice on women's health. She's also the founder of the Knowledge Project, an initiative focused on empowering communities with clear, reliable health education. And Dr. Nighat does incredible work tackling inequalities and breaking down barriers to care. And we're really excited to have her join us and talk about talking therapy and general like anxiety disorders. So can you explain to us what NHS Talking Therapies is and who it's designed to support?
So actually, you highlighted quite well the communities that the NHS Talking Therapies want to support. It's for everybody who's able to access it and go online, and you do your own referral. And the idea from the NHS Talking Therapies, which has been around for a while, but I think it was little known about, but we want to tackle some of the big areas because not just anxiety, which is one of them, but also obsessive compulsive disorder, because people think it's just a bit of OCD, not understanding it's a mental health condition which has clear symptoms and also clear treatment pathways as well. Post-traumatic stress disorder, PTSD, body dysmorphia, which is one of the rising mental health conditions a lot in the young teenage population. And I think social media drives a lot of that. And we used to think of airbrushed images, but now it's AI images, which everybody and the filters that we use. Also panic disorder, social anxiety. And out of all of those conditions, the majority of them, if you understand the signs and symptoms and possibly not downplay the symptoms, and hopefully not get dismissed if you do have the confidence to talk about it, then we know that the earlier intervention that we put in, the better the prognosis. But it's so much more complex than just saying you have this condition or these symptoms. And also, as you've highlighted yourself, our cultural barriers play a massive role as well. I'm Punjabi, so whenever I talk about mental health conditions or with my patients, they were like, "Main pagal ho gayi," and I'm like, no, you can't use that word. So it's trying to educate our communities of what language, what lexicon to use when it comes to their mental health, because it's really hard to talk about your mental health if you don't even have the words to describe it.
You mentioned social media earlier. Do you think there's an issue with people using these terms like quite casually, like, oh, that's just my OCD kicking in? And people sort of apply it to themselves, but it is a mental condition and it's something that needs treatment or people need support for. So do you think there's an issue with maybe people in the younger generation sort of being like, oh, I have this and I have that, and sort of just self-diagnosing?
So I'm a huge fan of self-diagnosing. I know, I say that as a doctor as well. Self-diagnosing sometimes helps because at least you're thinking it. It's known as voicing the fear. I have a bit of OCD. And then you want to test the room to see what everybody says. And if everyone's like, nah, you don't, girl, you're fine, you're all right, you know that room is not for you to talk there.
Yeah.
And so sometimes if you do say, oh, I have some OCD, and a friend is like, so I would be that person, like, so tell me, what are your symptoms? How does that come about for you? How is it stopping you from doing things that you want to do every day? Like, how does it manifest? Is it stopping you from literally doing the things that you want? Is it affecting your life? Is it affecting your livelihood? Is it taking over? Are the ruminations of your thought? Then you know, okay, I've now voiced the fear. I've sussed out the room, and the room is my tribe.
Mhm.
And that's what I think social media is, a good dipping your toe in the water to see what it feels like.
Yeah. That's really interesting. And then so coming to maybe that is like some of my conceptions of what the younger generation do, and you've talked perfectly about how to address that. But when we're coming to older people in our culture, in our families,
Yeah.
they're very, any sort of condition like this is a big no. Don't say that you have those things. Everyone's keep calm, carry on. How would we maybe approach talking to older people in our community and our families about conditions like OCD, panic disorder, um, general anxiety disorder? How would we talk to them maybe?
Just in the clearest terms that you possibly can.
Mhm.
So let's talk, for example, panic disorder. So describing things like what's physically happening to you. And I find that this is where lexicon really becomes an issue. So I apologize if no one speaks Punjabi here, but obviously I do speak Punjabi. So for me, it's trying to find those words. So it'd be like, I'm having, palpitations. मेरी धड़कन बहुत fast हो जाती है, जल्दी हो जाती है. So when you try and describe that to a person of, say, an older generation, they're like, okay, I can get on board with that. So the physical symptoms are important. मैंने पसीना बहुत आता है, so I sweat a lot. मेरे सोच जो नहीं है, वो मैंने इतना ज़्यादा जब बदलाव च फिरंदी है. So I get clouded thought processes. Feels like my head is in a fog. I lose clarity. मैंने समझ नहीं आती एक चीज़ तो लेके दूसरी तक. So I can't really have clarity or focus, cognitive function. And yes, they can be organic conditions that can be linked with those, but also trying to explain to the older generation, and this is where I think that being upfront, that this is actually something that my mental health is affected. My mother always says, "Ek hi hunda hai," which is, what is that? So that's the next thing that you'll get. Because I think then the concept of, well, I can't see your broken mind, whereas I can see a broken leg with a gash in it, and I know what to do. But the broken mind is something that I think is a difficult concept to get to grasp with, because your brain is so clever, it tricks you into thinking you don't have it. And so constantly you've got one half of you going, pull yourself together, you're all right, you're all right. And the other half is going, no, I'm really, really struggling. And so the idea is if you can communicate, verbalize what's in your brain out, then you can marry those two bits up so that you're able to then communicate with your friends and your loved ones and your older generation parents or your grandparents to explain to them that this is what's happening. I think the struggle comes when you're trying to vocalize it, but you get dismissed. So the dismissive nature is currently the biggest barrier that we have.
And that can happen within your own family.
Oh, in your family, your mates.
Gurdwara, wherever.
Everywhere you're going, you can have it.
What should people do when going to the GP and trying to seek this support?
Yeah.
Is it like, no, please listen to me, I really feel this way? Or is it that we could look online at the NHS website and look a bit more where to go for specific help?
I think hands down, advocacy is really hard when you're in the eye of the storm, because you don't know what is normal and what's not normal, and I often get patients who come and see me who goes, I feel like I'm being a drama queen, or I'm being oversensitive. I think what you need is validation. That's it. Number one, your job as a parent, as a sister, as a friend is validation, because that is just one step forward to say what you are feeling is totally true. And that's it. Then the next thing is to say, right, what are these symptoms that you're doing? And then secondly, what can you do to help yourself? Because the majority of people who have a mental health condition, they want to be believed, and rightly so. And then secondly, they're smart. They're proper smart. It's not something that's just happened over one day. They've lived with this hidden fear, shame, taboo, feeling that they're weak, feeling that they're broken for decades. And like my hands are getting bigger, but like
Yeah.
decades and decades and decades before they've had the courage to speak the fear that I spoke about earlier. And then the next thing is I think a symptom diary really helps. And if you've got someone that works with you who's able to give you that collateral history, so a loved one, a work colleague, a mate, your sibling, bring them along with you, to say, actually, they're probably downplaying the symptoms. They're a bit stoical. The real scenario is she doesn't get out of bed for 3 days, or her mental health is so bad that she hasn't eaten or washed. That the fact that actually she's not engaging and we've had to cancel events. She's not popping into work the way she used to turn up, or she's not present, or he's not present. So I'm talking about women because there's 3 women to us, but this is very much not a gendered conversation. And this is very much not an age conversation. So one of the things that the NHS has tried to do with tackling the barriers is to say, if it's really hard to get hold of a healthcare professional, you can self-refer to talking therapies. You don't have to wait for a very long time. And you just go online, NHS/talking therapies. You fill in an online form yourself and you do it. And then a healthcare professional who's trained within the NHS is able to contact you to say, this is what you need. And honestly, there's nobody from any race, background, class, age who isn't affected. And it's really sweet that you said you tapped into talking therapies, because I have as well. So I've had 6 CBT sessions for PTSD, and talking therapies really helped me.
Yeah, and I agree. I did 6 sessions of CBT for anxiety, and I think those sessions provided me with tools that I can still use now to calm myself down when I'm having such irrational thoughts, when I feel like I can't control things. But actually, the tools have really helped me to recognize where I'm going, maybe slightly downhill, and bring myself back up.
And implement those tools early enough before you're really entrenched. I think that's the key bit of cognitive behavioral therapy. I did mine about sort of 7, 8 years ago. And for me, I refine and refine, and they're lifelong tools. No one teaches you how not to be anxious.
Right.
Ever.
Absolutely. I mean, I get anxious every day. It's learning how to cope with it, and to, again, the talking therapy, the NHS talking therapy, the CBT has really allowed me to recognize my patterns where I maybe before wouldn't have, and just I kind of feel like I was stuck in a cycle, and now I can recognize where those thoughts are coming from, and that is down to the talking therapy.
Wow. So we're talking about a range of conditions today: PTSD, OCD, social anxiety, phobias, body dysmorphia, and panic disorder. So we're talking a little bit on it. So what are these conditions, and what signs can people look out for?
So there's a lot of overlap between them. So if we take obsessive compulsive disorder, it's ruminating obsessively over something, intrusive thoughts that you can't control. And if it means that an action has to be performed at the end of it, then that gives you temporary relief. Sorry, I can't seem to talk this. That gives you temporary.
Is it temporary?
You're
really?
talking really clear. I don't
Yeah,
know
you're
if
talking great. Yeah.
Okay. I just thought I was saying that wrong. So that gives you, for a short term, that's what I'm trying to say, short term relief until that intrusive thought comes back. Anxiety disorder is that feeling of anxiousness or angsty, feeling on edge, keyed up, worried, wired, overstimulated, thinking that something awful is going to happen. And that will have physical symptoms as well alongside that. So sweating, dry palms, dry mouth, palpitations, headaches you can get, feeling a little dizziness, also clarity of thought, brain fog. Panic disorder is a full-blown anxiety attack. Social anxiety is the fear of being in a large crowd. And it could be even a couple of people, or the idea of leaving a place of safety. That could be stepping outside your door. So a lot of people are very functional, I say social anxieters. So they actually do keynote speeches in large public, but before they get on the stage, and pop stars, we hear this a lot from like mega celebrities, that they are introvertly very, very social anxiety. They hate being in large crowds and large people, either being spotted or either wanting to take photographs, or just the fear of what people will think of me as I'm walking down the street and what people will think of me
Which I feel like is an integrated or, just sort of
within society.
yeah,
Naughty
within
gang.
but
I know.
especially South Asian community. Don't you
Yeah.
feel like, what will this auntie say?
Yeah,
What will
naughty
this neighbor
gang. I
say?
know. We
Mhm.
have it. It is entrenched
Yeah.
within that, and that is essentially an aspect of social anxiety. PTSD, post-traumatic stress disorder, could be an event, or it doesn't actually necessarily have to be an event. The mistake is, so in the olden days, they used to call it shell shock. So army people used to come back or from the war, and they would have shell shock, which essentially was PTSD. But it could be an event. It could be a life circumstantial change. It could be something that you've even witnessed that didn't happen to you, but something else that happened to somebody else far away. And now it's ruminating on your thoughts. You're getting flashbacks. You're waking up in your sleep. You're dreaming about it. And that flashback is consistent and persistent, and it's stopping you from doing anything. So cognitive behavioral therapy can really help, or EMDR, which is a type of therapy that can really help as well. And then body dysmorphia, which is a hyperfixation on an aspect of your physical appearance, which you feel is so repugnant and repulsive that you want to change it. So either that's the shape of your body, so weight comes into that as well, whether that's the way your nose looks, the size of your breast or your bum size, but you just become ultra fixated on it. And even if you change it, you're never satisfied with the results.
Mhm. So, like some of these conditions, I guess, they have sort of some misconceptions or there's some myths about them.
So I think that the issue that we've got now is that sometimes the rationality and just losing perspective of a situation and thinking this is over extreme. The other misconception is that it's just a bit of OCD, and I want to come back to that because we downplay the severity of it. And finally, we think that social anxiety can't happen to people who are out and about living their best lives.
Yeah.
When actually, I would say the most insecure people who have social anxiety who I see are usually the people who are the loudest on social media.
Yeah. Yeah.
So it's your happy, loud friend that you need to check on their mental health.
So we've spoken about what different kind of conditions there might be, what symptoms there might be. But Harmeet, you have actually used NHS Talking Therapies. Can you tell us a little bit about when you first started experiencing symptoms? Because I believe it's panic disorder that
That's
you
right.
later then came to realise that, I have
Yes.
this disorder. So
Yes.
but do you mind telling us a little bit about your experience?
Yeah, I do remember it quite vividly. So I was driving in the car and I had my sort of newborn daughter with me at the time. And suddenly, while I was driving, I remember her crying actually at the time as well. She was very, very small. I suddenly started sort of having this dread, this feeling of dread. And it was so I had some physical symptoms, which was the heartbeat was very fast. I couldn't control it. And then it was this kind of everything just didn't. I felt very disorientated. That was the other thing, and I felt like I was going to die. Ultimately, that's what it kind of. And I had to stop. I was on the motorway, and I had to stop, like on the spot, because I thought something bad was really happening to me because of the physical symptoms, and I had no control. I could not calm myself down. I had the baby crying in the back. And actually, I didn't know that that was a panic attack. I actually thought that there was something physically wrong with me. And that was my very, very first experience of panic and panic attack in particular. Um, Thereafter, I would say I did have, I had obviously I had another condition as well, which was postnatal depression at the time. So I was obviously I was referred for help with that, but the panic was still kind of going on in the background for quite a number of years because I had not addressed it. I hadn't addressed the panic. So what started to happen was I started to feel afraid and fear of many things, because every time that I would have a panic attack in any situation, whether that be now in a social setting or even at home or wherever it was, because these panic attacks started to happen more often now. And I basically isolated myself. So I stopped driving, I stopped going out of the house, and I just sort of kept my baby at home quite a lot. And I stopped doing a lot of the things that I used to do just to kind of not feel the fear or to escape the fear and the panic. This went on for several years. I would say at least sort of 4 or 5 years. And it got to a point where it was really debilitating. It was really affecting my quality of life because I would avoid a lot of things. I needed motorway driving was just totally like I stopped doing so many things that I would normally do. So it was at that point where I just thought, you know what, I cannot carry on like this anymore. I think I need some kind of help because this doesn't seem normal. And it was at that point that I sought help.
Wow. And so how did you discover NHS Talking Therapies as your point of self-refer or, this is where I'm going to go to for help?
So the panic led to me feeling like I actually didn't want to be alive. So panic itself, or having panic attacks because you cannot live the normal life that you live. Well, I felt like I couldn't live a normal life. It got to a stage where I felt like I just don't want to be here. And that's what led me then to go and see my GP. And the GP sort of asked, why? What's the reason? And I said, I have to sort of live a very kind of caged life and, I'm avoiding doing all these things and I'm feeling like this is happening to me all the time. I cannot control it. And they told me about the talking therapies. I had a really lovely, lovely GP that I saw. And they taught me through talking therapies and said, you can self-refer. So I went, after speaking to the GP, I felt sort of almost like I felt listened to, I felt heard. I felt like there might be a way out, that actually, there was something. And then I went away and I did the self-referral online. And then I had a phone call, which was the assessment. They did the assessment and then I was referred, and then a therapist actually took me on board. And I had face-to-face CBT therapy. And I had that for several months. Firstly, there was understanding it. What is panic? What happens when you have a panic attack? And it was explained to me. I mean, it was amazing because you have this board and she would draw things out and she would describe this loop, how the brain works. It was really amazing things that I actually learned about my mind.
Mhm.
Which was that, when you go into panic, this is what your brain's trying to do, and then you're looping, and then you can never stop this loop, and you're just stuck in it, and that's what's making it sort of come back every time. And it was almost about me learning how to interrupt that loop. So that was one of the things that I learned, was how to interrupt the loop. There was also about the worry side of it, is worrying about having a panic attack.
Yeah.
And how to control the worry about it, because that's also a situation that you can get stuck with. Then there was this idea of graded exposure, so getting back into the rhythm of doing the things I used to do. How do I get back in the car and be able to drive and not feel too uncomfortable, but comfortable enough that I can go the next step and the next step. So I learned all this. I would call it a toolkit. And I would say very honestly that I think everybody should do CBT because it is literally a toolkit for life. It's the thing that's inspired me to become a mental wellbeing coach. I now coach others on this, and it's inspired me because I've learned something, and it's one, and I use it today. If I have something, I know, okay, I need to do this thing. And it's about self-awareness because we're running on autopilot a lot of the time. We're running from our subconscious sort of belief systems, and now it's about becoming more self-aware and really learning to understand what your mind is doing, so that you can actually interrupt it. You can interrupt what's making you panic, and stay there. It's the most wonderful thing that I've ever learned, you could say, in my life, to kind of get me back to doing well,
Being yourself.
to being I think to be a better version of what I was, even when
Oh, wow.
before I started, because now I have more knowledge about my mind.
Yeah.
How did you find talking about your panic disorder with your family? Because you weren't leaving home for 5 years.
Yeah, so I would rely. So I would go, but I would rely on everybody. So I'd really lean in on people. So it was doing things on my own was hard. And the thing is, it was really hard. So I would say what I found really hard was making others understand
Yeah.
that it was a mental health disorder, that I wasn't putting it on, wasn't being a drama queen, I wasn't exaggerating it. It was very real for me. And all I wanted at that time was to feel heard, to feel seen. I needed the support, validation. That was so important, because you will only you need to be validated first to feel that it's real. What is happening to you is so very real. And then you can once you feel validated, then you can sort of seek that help and move to the next step, because now you're feeling seen and heard. But I would say in our community, you are labeled as, oh, you're going mad, you're crazy, and you kind of put in this category. You're labeled incorrectly, and that's what prevents us from speaking up or even getting the help in the first place. You just hide away.
Yeah.
And you make yourself more ill, and it's not visible. It's not a visible. I would go to places and functions and integrate with family, but I was so scared all the time. I would sit there and just sort of sitting there, like holding my hands really tightly, sweating, palpitations, feeling of dread, and going to the toilet, hiding away. It was very, very hard, and everybody around me thought I was fine, but I wasn't.
Yeah.
I was really suffering. And you don't forget those times, actually. But it makes you stronger. And the thing I learned was, I thought I would never feel myself again. That was my biggest worry and concern, is now I've got this disorder, am I ever going to be able to do the things I used to do? Am I ever going to feel myself again? Or have I lost a part of me? And that was my greatest fear. And what I learned was, actually, you can.
Do you think your postnatal sorry, I'm really taking
No,
No,
go
please
for
go
it.
for it.
Yeah.
We love it.
Did your postnatal depression come first, or did your panic disorder, was that there way before you had your baby? Because you said it was your newborn baby.
Yeah, that's the
Because-
best time that I
because
ever had
I
a
think
panic
what
attack.
people don't realize is that mental health conditions aren't just a spark in the night. It is literally a combination of years and cycles of something else
Yes,
triggering off something else,
Yeah.
triggering off something
I
else.
was told that.
So
yes.
was your postnatal depression, which again we never talk enough about,
Yes.
because it's so shameful and taboo, was that what led to your panic disorder?
Yes, I would say
Not
so.
the other way around, that the panic disorder was always there from your teens and stuff.
I think I always, obviously, I think I had what we would term as anxiety
Okay.
growing up anyway. And I think things resurface, from my knowledge, things resurface at different times. So when I became a mum, something from my past, it was like an added thing now to something that might have occurred before, and it's resurfacing, because it's just when things get too much, the brain's responsibility, the brain's job is to keep us safe.
Yeah.
That is the main function of the brain. It's always going to try and keep you safe. So it's doing that. It's actually doing its job. It's warning you of danger, but sometimes the danger isn't really there. It's not actually real. It's misfiring. So I think, yes, definitely so. When I had my baby, I had the postnatal depression, but then the panic kicked off, and that was the very first time that I actually had a full-blown panic attack.
Yeah. That's so
Um,
scary.
It's so
It's so
scary.
scary.
With a baby, it's one of the most scariest things, because I thought I was going to die, and you think, I've got a small baby. What if something happens to me? What will she do? What will I do? So and you're in a car and you're on the motorway. So it just goes to show that with any mental health condition, you've obviously touched on a lot of the other ones as well, that actually getting help as soon as you realize when it starts affecting you, affecting your daily life, and it becomes intrusive, it's something you can't just sort of brush it to the side. You have to, because one day you will have to deal with it, because it will get to a stage where you'll be forced to deal with it.
Yeah.
And I did deal with it too late. I mean, staying in a panic mode, staying in flight, fight, freeze for so many years is has not really. It didn't enable me to be myself for so many years, because I was in that mode for so long, and I was always scared. So
But you were surviving. You weren't
yeah,
thriving. You were
no,
literally just
yeah. I was just existing, I would say.
Yeah.
I was just existing. And I think then it can go into like depression, and it can go into, then the suicide.
It can snowball.
Yeah, it can lead to other worse sort of
Yeah.
mental health conditions, I would say.
And lived experiences. Yeah.
Yeah.
Yeah. I resonate with some of your experiences so much. I remember when I was at university in my final year, I started having panic attacks, but I didn't know that's what I was having, because again, we don't talk about it enough in our communities. And I remember one day, I think I tried calling my mum because I just didn't know what was happening. And I lived with my sister at the time, and we were in the same uni halls. And my sister was next door, and this is how much I felt like I couldn't ask for help, because she was next door, and I couldn't ask for help. And my mum sort of had to call her and say, "Can you go check on Nikki?" And I remember Tasha saying, like, I thought you looked like you were dying, or what was it? And that's what it felt like.
Yeah.
That's honestly
What
what
was
it
the
felt.
reason? Like, what was the barrier? What was the mental barrier to go next door?
I think probably just eldest daughter syndrome. Now that I'm like more aware of what that is, I think I'm the eldest. I've never ever asked for help. I'm meant to be the strong one. So even though my sister was next door, I was like, I just can't go and do this. And I was like, in my mind, I was like, I'm just gonna die. Like, I'm just gonna be in this room, and like, bless Tash is gonna find me. And like, all of those thoughts like go through your head. It's really, really bizarre. Um, and I'm just sitting listening to your experiences, thinking like, wow, I need to go to talking therapy, because I still haven't sort of dealt with panic disorder, or talking about it really. So yeah, thank you so much for sharing that, because I was like, oh, it's taking me back. Yeah. So you shared some practical techniques and strategies. You spoke about your toolbox. Can you share a few of those techniques with us?
Yeah. So one of the things was breathing, diaphragmatic breathing. I remember learning that. That's just to because what can happen is when you breathe too quickly, you're taking too many breaths, you can hyperventilate, which makes the symptoms all the much worse. So just slowing down your breathing and learning to do that diaphragmatic breathing is actually really helpful in a situation like that. Then it's also about, I actually was taught about building my own toolkit as well, about what I can say to myself at that time. So is there and I'd write it in my phone. So I am safe. There is no situation I cannot handle. I was taught how to build this concept of, my brain is telling me I'm in danger. How can I almost tell my brain I'm not in danger, so that I can interrupt the loop? How do you interrupt that loop? You've really got to ask yourself, am I really in danger? Is there something really bad happening? And you realize suddenly, oh no, I'm just having a panic attack. And then there was this thing about worry. So I did keep a worry diary, but also just when you have a worry. So I used to have a worry a lot about having panic attacks. So I used to say to myself, okay, I've got this worry, and I was taught to question the worry. So is this a real problem right now? Yes. Is there a solution to this problem right now? No. Park it. If there's a solution, what can I do right now to help me with this problem of the worry, whatever the worry is? So I was taught that. Then I was taught about, if I'm restricting my life, if I'm restricting myself, what can I do to help myself get out of that situation? What can I do? So if I'm really scared to do something, why don't I try to do a bit of it? Because actually, caging yourself away, and this is obviously after you've tried some of the other things, to try and reintroduce yourself back to those things slowly. So the anxiety, then slowly the panic starts to go away. But you almost have to do the hard stuff to get beyond that point. It was almost like it's facilitation. So in CBT, they facilitate in you building your own self tools, and what's going to help you. And they give you exercises to do. And then you go away and do those and you experiment with those. But I would definitely say that's my toolbox. I have affirmations. I have things in my phone. Even now, if I were to get nervous about something, I don't even actually have to look at my phone. I just know what I'd say to myself. If I feel a moment of panic, because it can happen to us anytime. It doesn't mean it will never happen to me again. But I know that if it does, I know how to control it and not let it control me. Because what often happens with a panic attack is it starts to control you. But I actually know how to get hold of it and say, oh, you're back. Okay, I know what to do.
Yeah.
And that's it. And that is such a wonderful place to be, because it does sort of make you feel like you're in control again.
Yeah, and that's so important, especially with panic disorder, because the feeling is quite literal panic. Oh my God, I'm going to die.
Yeah.
I'm losing control. I remember when I was having mine and I was on the street and my body was locked. I couldn't move. I was like, oh my God, I'm actually going crazy. Really, yeah. So it's so
But
important.
if you can basically unlock your tool that helps you break that loop, you can unlock that. That is your key.
Yeah.
And it will be different for everybody, but it's finding that. It's finding the thing that interrupts it for you. Because I don't think there's my way is my way, and I think everybody can have a different way.
Yeah. What would you say to someone who's listening or watching this podcast who might be experiencing similar symptoms? What would you say to them?
What I would have wanted somebody to say to me,
yes,
which is that you're not always going to feel like this. You can get better, you can recover, you can get back to yourself. This doesn't mean that life has changed and this is how life's always going to be, and you're always going to have you're always going to be in this fear and panic. And you can get rid of it, actually.
Yeah. What would you say, Dr. Nighat?
I would say that touching on a lot of your points, everybody's toolbox is really different. For some individuals, their toolbox is regular exercise, looking at their nutrition really well. It could be actually just managing their sleep, because we forget about sleep being so important to rejuvenate. Not just sleep that you get some sleep, but actually regenerative, recuperating sleep. And that's not you being lazy. And letting your mind procrastinate. I think we fear our mind not doing nothing. When your mind is rushing and so busy anyway, then having some downtime for your brain is so important, which we don't do really enough of. And then I would finally say that the burden that you carry doesn't have to be yours to carry alone. I think the first child, or the eldest daughter syndrome, I felt that to my core. I'm the eldest of 5, so I feel that. And there's that maternal instinct, I think, that you just have as the eldest. But it's really lovely that you said to be told consistently, you will get better, you will get better. I do that a lot with my patients. I say to them, you are literally in the eye of the storm right now, but one day you won't be. And that's when all these tools that you're picking up along the way, you just need to remember what it feels like to be in the eye of the storm, and you can get yourself out of there. So if CBT doesn't work the first time, you do it again the second time, the third time, the fourth time. And you know that the first time probably wasn't perfect.
Yeah.
So not to bank all your weight and your mental load that you have to go, right, I'm going to have my first session and I want to come out fixed on the other end.
And the other thing that, I really love that it's called Talking Therapies, the service itself, because we underestimate how important it is to talk. Whoever it is that you feel comfortable talking to lean on the people that can support you, because when you're in a state of panic, you feel like you're on your own. You feel like you're carrying this weight, and there's no one that can help you. But actually, the moment you talk to somebody that you connect with, that weight does start to feel a lot less. And I
That's
really,
a set of validation, isn't it?
yeah, and just feeling like you don't have to carry that in your mind alone, because you're already carrying the panic all the time. You're always trying to prevent a panic attack. You're always trying to anticipate one. So when you talk to someone, you think, oh, at least I could share that, and at least that person knows. And then when you're out in a social situation, if somebody knows, then they can support you, they can help you. They know when you, maybe the signs, you can let them know, this is what happens to me. Or if I just kind of put my hand up, I need you, that means I need your support. Just that, even that helps.
Yeah.
Ideally, what I would love is that we don't need talking therapies, because
Yeah.
we're able to talk,
Yeah.
be validated, and our truth is heard in our homes.
Yeah.
So kids, when they talk about their worries, so I have a 15-year-old and I've got a 10-year-old and a 7-year-old. And maybe it's because I am a medic and I do understand mental health. But when my 7-year-old talks about his worries, I listen and I take the time and I validate his worry. And he's got like a little worry box now that I teach. And I think that's the thing, because there are great things about being South Asian. Like I love being South Asian. I love being Punjabi. We're big fat Punjabi people in our house. But I mean, like, we are so good at the community bit, but we're terrible, I would say, at the actual letting people talk their truth.
Yeah.
And I think it's education, actually.
That's it.
It's the
awareness and the
education.
education.
Because I'm Punjabi culture as well. And the thing is, it's because it's classed as having any mental health condition is classed as being crazy in our community.
It's because we don't have a lexicon. Like, we don't have a word.
We don't have a word to kind of, I suppose, name it.
Yeah.
So, and I think it's also something to do with you cannot see it. What you cannot see, you cannot name.
Yeah.
And that's where the problems sort of start.
That's so true. Dr. Nighat, can I ask you, from a medical perspective, can seeking help really make a difference for someone who's been struggling with anxiety or related conditions without speaking up for years? So, in your profession and your experience, would you say, there's a success rate with people who have undergone some form of talking therapy? And I mean, your prime example, Harmeet, of it's amazing and beautiful that you're now a well-being coach and you're helping other people from what you've experienced. So yeah, you're a prime example of that. But yeah, coming from what you do in your day-to-day work.
So clinically, I would say 90% of my consultations have a mental health slant to it. So even if someone's come in going, I've got a knee that's really painful, and when you drill down their symptoms, it's because actually they're really worried that they're not going to make their daughter's wedding that summer and they need to get their knee better. So there's a mental health slant. I guess there's a physical thing, but there's a mental health barrier as well that actually could impede or hinder the physical aspect and the healing process of that. So when you actually talk that worry about carrying the load, you're already carrying the panic, you're already carrying the worry. So by talking someone down from that, you can actually bring them back from the brink. And I find that phenomenal. It's not a drug. Yeah. It's literally words.
Yeah.
That you can bring someone back from a suicidal thought pattern to back down where they feel grounded and safe.
Yeah.
And then build them up to feel that they never need to get to that position, because that position is proper dark. And I see it in my clinics. And I see it. I did A&E for many years. We hear of people who are able to talk someone down from a cliff edge or a bridge edge and be able to bring them down. And that is the power of words. We underestimate that.
Yeah.
Oh, absolutely. I 100% agree with the power of words.
Well, all the words shared and spoken during this podcast or this session, it's been incredible. I've honestly taken so much from it and been inspired and enlightened by you both. So thank you so much for joining us. And yeah, so we always end and we say it's your girl Nighat, but you don't have to join in, or we could outro you.
It's your girl Nighat.
Yes, love that.
Look, I'm an old woman, but I'm down with the kids.
Yeah.
You guys are much younger than me. I'm very much.
Tasha's already calling me auntie these days.
I get called auntie all the time.
She's a real auntie, I'll tell you that.
I'm 41, mate.
No.
You don't look at you guys.
Well,
Look at your age
I'm
at all.
53.
Are
No.
you?
I
Oh
know.
my
When
God.
you told me that, I was like, no way as well.
Oh,
I know.
41 and I'm perimenopausal, but I'm your girl, Nighat. So
You know,
with
you
it.
guys look so youthful because you share your worries and you tell.
Yeah.
That's
is
why.
is that the
Yeah.
reason?
No, that's
good.
not clinically
That's a,
true.
that's a really good
but,
it's a really good explanation. I like that
wonders for
one.
your skin. Yeah. Until next time, it's been your girl Nikita,
It's been your girl, Tash.
It's been your girl, Dr. Nighat.
It's been your girl, Harmeet.
and you've been listening to Two Chickpeas in the podcast.
If any of these conditions are impacting your life,
Then you can visit nhs.uk/talk.